Good afternoon, I'm Shawn Yao and this is One News Now. Experts are seeing an upward trend in the number of COVID-19 cases in the country, confirming the post-holiday surge, especially in the NCR. To give us updates, Greg Gregorio reports to us live from Mandaluyong City. Hi Greg, at what rate is the increase in cases going as of today?
Sean, unlike the unstable average of daily new COVID-19 cases at the start of this year, the OCTA research team is now seeing a clear upward trend, especially in Metro Manila. According to OCTA's latest report, the average daily new cases in NCR is now up to more than 400 from 295 during the holiday season. With this, the reproduction rate, or the number of individuals who might get infected with the virus, is up to 1.17. Last time it went over 1 was on December 21, before it declined to an ideal below 1 rate. In an interview with 1PH's Sa Totoo Lang, Dr. Gov't of UP OCTA says this might not be the full picture yet, noting that some laboratories have just recently resumed normal operations. Recall that according to the Department of Health, the trend of cases has been affected by the number of labs that did not operate in the holidays or did not receive the usual number of specimens to be tested. Public health advocate Dr. Anthony Liachon predicts the numbers to go higher as authorities expect the full picture of the post-holiday surge by January 15. Liachon also fears the number of cases might balloon come January 24 or 14 days after Teslasyon in Manila, where a large number of devotees attended. OCTA warns that if the cases would continue to increase, the government might have to implement measures to counter the trend. Sean, Undersecretary Maria Rosario Vergara of the Department of Health confirms the increased number of the reproduction rate in the country because, according to her, aside from the National Capital Region, the R0, including the R0 for areas including the regions, is at 1.1. But Vergara says these numbers should still be cautiously interpreted as they have to monitor these numbers for another week. Sean?
All right, thanks Greg. We'll have to note that higher are not around the country. Greg Gregorio reporting to us live from Mandaluyong. A public health advocate slammed Malacanang for supposedly limiting the public's options for vaccination. In an interview with 1PH's Sa Totoo Lang, Dr. Anthony Liachon says that Filipinos deserve to choose the most effective jab. Liachon is calling on the government to uphold the people's right to health by considering the results of vaccine preference surveys.
Ang health kasi is a basic human right. And we deserve an option na kung ano yung tama para sa atin. Kasi kalusugan natin yan eh. Kung anong ituturok sa atin, karapatan natin malaman kung ano yun. At gusto natin yung pinaka-effective at saka pinaka-safe.
The expert also criticized the government for citing colonial mentality as rationale behind the preference for U.S.-made shots. On Monday, presidential spokesperson Harry Roque announced that 25 million doses of vaccines from Chinese firm Sinovac have been secured.
Medyo off sa akin po yung comment na yun kasi ang dapat pahalagahan natin ay yun pong kalusugan ng bawat mamamayan. Kasi kung mag-i-inject tayo at makakasakit tayo at hindi rin effective, the whole vaccination plan of the government will fail.
City mayors will be meeting with the national government to iron out vaccine procurement concerns. The League of Cities of the Philippines President and Bacolod City Mayor Evelio Leonardas tells the chiefs that they have formed a vaccine availment committee for the procurement of shots. He wants city mayors to be able to choose which vaccine brands to purchase since it is still the national government that will be handling distribution. Leonardia also wants the national government to extend assistance to poorer cities as they don't have equal resources.
There will be some cities who might need more help from the national government, and that is why initially what we've been doing was to ask for the voluntary offer of these different cities to how much would they be able to allocate to help out in the vaccination of all our people all over the Philippines.
We're going to pause for a quick break, but we will be back with more stories after that. Stay with us.
Break pa. That's 1, 2, 3.
Hi, Mase. Hi, Mase. Can you hear us sa studio?
Yeah.
There.
Hi.
Hi. Yes.
Yes, clear.
You are still watching One News Now. I'm Sean Yao. 4 more countries, including China, have been added to the travel restriction list. Maricel Halili joins us live from Mandaluyong to talk to us more about this. Mase, which other countries have recorded cases of the new COVID-19 variant, and have they been added to the travel ban here?
Yeah, Sean, as you mentioned, China is now included in the list of countries which is subject to travel restrictions. Aside from China, presidential spokesperson Harry Roque also announced that some of the countries that are now included with the travel restrictions are Pakistan, we have Jamaica, Luxembourg, and Oman. This is effective 12 noon of January 13 until January 15.
All right, so did spokesman Roque explain his remark that Filipinos can't be or shouldn't be picky with which vaccine brand they are inoculated with?
Yes, Sean. Actually, both Secretary Roque and Cabinet Secretary Carlo Nograles explained the procedure that we cannot be choosy right now in terms of the usage of COVID-19 vaccine. But of course, they will not force those Filipino people who are not willing to be injected with Sinovac, which is expected to be available by February. Secretary Roque mentioned that this is the only vaccine which is readily available for the first quarter up to July, because the vaccines which will come from Western countries will only be available by second or third quarter. So it will be difficult for us to procure such vaccines.
All right, and did he mention what would happen if a person does not agree to be vaccinated with Sinovac, which is from China?
He did. Both Secretary Roque and Secretary Nograles explained that the cabinet secretaries agreed before the IATF that once the Filipino or a Filipino citizen declined to be injected or to use Sinovac, which is the Chinese vaccine, they will simply sign a waiver saying that they decline to be vaccinated with Sinovac. And instead of being part of the priority for the vaccine, they will be listed at the end of the queue. So they have to wait for the availability of other vaccines if they also want to be inoculated.
Right, okay, clear about that. There's also a lot of talk about the supposed monopolization in vaccine procurement. Also, how does this tie in with you saying earlier that Sinovac's vaccine will be available next month, but it still doesn't have an EUA? And yesterday, Director General of the FDA, Eric Domingo, said that it'll take about 3 weeks, so that will melt into February.
Yes, you're right, Sean. Actually, Malacanang ensured the public that they will not use Sinovac until the EUA has been approved by the Food and Drug Administration. But because, of course, this is a requirement to ensure the safety of the vaccine. So they have no choice but to wait for the EUA, and hopefully they can process it within 21 days and made it available by February. When it comes to AstraZeneca, because there are some issues that some local government units are becoming choosy in purchasing vaccines, and some are questioning why do they choose AstraZeneca. Well, the reason behind that is that according to Secretary Roque, the national government has signed an agreement with the COVAX facility. The COVAX facility has an accredited vaccine, and one of those vaccines which is accredited by the COVAX facility is AstraZeneca, which is the vaccine that came from UK. So since it is the available vaccine that has a ready tripartite agreement, that's the reason why LGU are choosing AstraZeneca to be purchased by third quarter of this year.
All right, thanks for that. And since you're talking about LGUs procuring their own vaccines, the national government is also being called on to help the LGUs that maybe can't really afford or have that much funding for vaccines allotted. How will this go? Did the national government already have anything to say about this?
In his press briefing earlier, Cabinet Secretary Carlo Nograles mentioned that during their cabinet meeting last night, the Finance Department has assured the President that we have at least roughly around 70 billion pesos allotted for the purchase of vaccines. So the Finance Department is saying that we have enough money for the purchase of vaccine. It just so happened that some of the local governments also have excess money, and they chose to buy their own vaccines for their constituents. But should the local government doesn't have enough money to purchase, the national government is always there. They have the money to buy vaccines for their constituents, of course.
Thanks so much for all that information. Maricel Halili joining us live from Mandaluyong. In other news, Malacanang wants the National Telecommunications Commission to impose sanctions on internet service providers whose platforms are being used for child pornography. Cabinet Secretary Carlo Nograles says under RA 9775, or the Anti-Child Pornography Act of 2009, providers must install technology that will immediately block access to child porn. He says the Justice Department recommended this to stop what he calls the disturbing rise of online sexual exploitation amid the pandemic. The NBI is now looking into various reports of students selling lewd photos and videos online to finance their studies. The palace has also urged Congress to prioritize bills that will curb child porn. And new MMDA Chairman Benhur Abalos has vowed to focus on improving the bus lanes along EDSA. In today's Laging Handa briefing, Abalos said he's now requesting for reports on the status of these bus lanes. He said this will be on top of efforts to private firms to open up new roads to decongest traffic. Abalos is also set to discuss the closure of several U-turn slots with the Public Works Department.
We could now focus on the bus lanes. Sa ngayon po, hininga ko po ng report. Gusto kong makita kung ano pong performance talaga ng bus lanes, and probably we could just improve on these things.
For more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. I'm Sean Yao. We are One News.